once we understood that the heart was a loop and it was polarized with the help of dining, so how does these septations are made? So how those chambers are made? We said that heart was first like a loop and that was polarized. So dining was only helping with the polarization, not with the septation. And we know that atrium has a septum inside, atria and ventricle has a septum inside, and ventricles also has a septum inside. So uh, how those are made? For those who join my neurology lecture, I said that whenever this is ectoderm, this is endoderm, and this is mesoderm. In the middle of the mesoderm, there is a notochord and notochord falling down the ectoderm and making neural tube, right? And around the neural tube, there is neural crest, and this neural crest migrates everywhere and makes different organs. For example, neural crest makes the peripheral nervous system, the neural crest makes the enteric nervous system and the gut. And at the same time, these neural crests come to the heart and make the endocardial cushion. Endocardial cushion is like a marker in the heart. This is like a spot in the middle of the heart, and this spot is like a marker. This just uh, helps the symptoms to come toward this one. So in the middle of the heart, this neural crystal comes and makes endocardial cushion. So uh, the uh, the atrium knows from where the septum should start. The septum, which is like a membrane, starts from the upper part of the heart to this endocardial cushion to make the two atrium and the septum inside the two atriums, and also from downside as a membrane comes and makes the two ventricles, and they point out and they reach to endocardial cushion, and also from left side and right side membrane comes toward the endocardial cushion and makes the EV membranes, right? So we consider it as a transection or like intersection. I mean, intersection between all four chambers. So the endocardial portion is a spot where all the symptoms reach to this point and make symptoms everywhere. So at first we will study the membrane or the septum, which is inside, which is between two atriums, and then we will study the septum or membrane, which is between two ventricles, and then we study the septum, which is between aorta and pulmonary, and also between atria and ventricles. So how those septums are made, and I'm going to explain a very easy way to remember. We don't need to make it so difficult for us. Just in order to not to make it boring or difficult, let's do it in my way. I used to imagine that a heart is like a hole, right? In the middle of the heart, we consider this is endocardial cushion, just uh, like a spot in the middle, and this is just like the target of all symptoms to go through. For example, the symptom for atrium comes from upper part of the heart to endocardial cushion. Just it stops here and makes the interatrial septum. And the symptom, this is like ventricle. The symptom from ventricle, this is the muscular part of the septum, and this is the membranous part. Of course, the membranous part of the symptom starts from the muscular layer of the interventricular septum, and it goes towards the endocardial portion. And also the symptom from both sides come here and make heart as a four chamber. This is atriums, these are ventricles, everything is separated. We have left atrium, we have right atrium, we have left ventricle, we have right ventricle. Atria and ventricles are also separated at the same time. The aorta and pulmonary is also divided. So the marker for all of them is a spot which is called endocardial portion. So all of those symptoms only know where to go. They just find endocardial cushion. Whenever they see endocardial cushion, they travel towards the endocardial cushion. So let's start from the atrium. Let's start from the atrium and see how the symptom is made. We said that the heart first was like a tube and it was polarized to right and left. Now the symptoms should be made so that we have four chambers. Endocardial cushion from neural crest cell came here and is spotted in the middle as an address for all the symptoms to come here. So now that you see, this is endocardial cushion. This is endocardial cushion, and these are the atriums. Now these are not the atriums. These are all like there is a hole between two atriums. We know that these will make the atrium later on, but at the moment you see that this is a hole. This is like left atrium. This is right atrium. Inside the left and right atrium, you see there is a hole. Isn't it like uh, a hole between two atriums? There is no membrane, right? So we call we in Latin we say ostium. Ostium means a hole. So at the beginning there is a hole. It means there is a way between two atriums. So this is called ostium. We say this ostium. Ostium means a hole, right? There is an ostium between two atriums. This is left atrium, this is right atrium, and in between both of them, there is an ostium. And this ostium is called ostium premium. Ostium premium means that the primary ostium, the first ostium, this is the first ostium, right? Now that endocardial cushion is here, this part of atrium knows where to go and how to make the symptom. So from here, the symptom starts and goes down to the endocardial cushion. This is called septum, right? Septum premium. And the name makes sense. When we say ostium premium means the first ostium between the two atria. And whenever we say a symptom premium, we know that this is the primary symptom. So at first there was ostium, there was a hole between two hearts, between two atriums, and then a septum from the upper part of the atrium came down to the endocardial cushion and made the symptom premium, right? So now that the symptom is coming down, you see that it is connecting to the endocardial cushion. Now that the heart says that, of course, I wanted two atria, left atrium and right atrium, to be separated, but I didn't mean to be disconnected from each other. We need to have a connection in between. We need to have something in between so that the blood moves from right to left. Why? Because inside the uterus and or in utero, the baby needs away from right atrium to the left atrium. Because why? Because the baby needs lots of foramines and lots of ducts and ways from the right side of the heart to the left side of the heart in order to carry oxygen of the mother to the baby to the left circulation, because the baby itself cannot have enough oxygen and cannot inspire oxygen because the baby is floating inside the uterus and amniotic fluid and there is no oxygen. So all the oxygen from the mom's body is coming to the baby, and the baby it comes to umbilical vein, and we all know that veins come to the right side of our body. At the same thing, the vein brings oxygenated blood to the right side of the body of the baby, and the baby needs to send those oxygenated blood to the left side. Why to the left side? Because we know that the left side of our heart has aorta, and aorta can send the blood all the systems to all over the body of the baby. This is the reason that right side of the heart of the baby should have a connection with the left side of the baby. Why? Because all the blood which is coming from the mother to the umbilical vein, and umbilical vein goes to the right side of the heart. However, in our body, veins don't have oxygenated blood, but in the baby, the umbilical vein has oxygenated blood because the mother gives the oxygens to the umbilical vein, and umbilical vein travels towards the right side of the heart. And if right side of the heart doesn't have connection with the left side, the oxygenated blood will not be able to move towards the left side of the heart, and the left side of the heart will not have enough oxygen to send to the system of the baby, right? So here, now that the symptom premium is made, the heart says that there should be a connection. There should be a small connection. I didn't mean to close it. I just wanted to have a symptom, but there should be something in between. And here, this part of the symptom starts to uh, This is this part of the symptom. Let me. It starts to regress, right? This part of the symptom starts to necrose. A small perforations, just in order to make a connection between right side of the heart and left side of the heart. And the reason I already said, but we will, if we continue with the cardiovascular, we will study about fetal circulation in a very nice way so that we remember it forever. So we said that we had ostium premium, heart was like had a hole inside. Why at the hole inside? Because left atrium, right atrium, left ventricle, right ventricle, all of them had connection with each other. This was called ostium premium. And then a symptom from the upper part of the heart came down to the endocardial portion to divide left atrium from right atrium. And this division disconnected right side of the heart to the left side of the heart, and we didn't want this to happen. So this symptom, which is called symptom premium, starts to regress or involute. Not from all over, but just few parts of this symptom is involuting and regressing and making holes again. So now you see that this is another hole. This dark spot is another hole between right side of the heart and the left side of the heart. So we know that whenever we say hole, it means ostium. Now that this hole is made, this is called again ostium. This is another ostium. This ostium was primary ostium. And this is secondary ostium. Ostium secundum means that this is secondary ostium. According to the name, when we say ostium premium, we should understand that this hole was made primarily. It was from the beginning. Whenever we say that symptom premium, it means that this symptom was made primarily. This was the first symptom which was made. And when we say ostium secundum, it means ostium secundum means that this was made secondary. So where this ostium secundum was made, this was made on this premium symptom or on the primary membrane. Now the heart has another symptom. So this is called ostium secundum, right? Ostium secundum, and we have symptom secundum. Second symptom as well. We had ostium premium, symptom premium, ostium secundum, and symptom secundum. Now another membrane comes to the right of the heart. This is another membrane. This is called symptom secundum. It means that this is the second symptom which is made in between the two arteries. Why this symptom is made? This symptom is helping the baby for after the birth. So everything is organized so well, and this symptom is considering the future of the baby. Once the baby is out of the uterus and starts living outside, so the connection should be stopped. So this symptom secundum comes from the right side of the ostium secundum. In order, why is it made? Because it is made because whenever the baby is delivered, this symptom secundum does not let the connection between left atrium and right atrium. Why? Because once the baby is born, the baby starts breathing, and lots of oxygen comes inside the lung, and the baby is able to exchange gases. And the baby doesn't have umbilical vein to get oxygen from the mother. So we don't need the right side of the body to be connected to the left side of the heart. So there shouldn't be any connection. The hole should be closed. And in order to close it, we need to have this second symptom. And once this second symptom, let me make it with another color so that this is the second symptom on the right side. So whenever the baby is inside the utero, and that in utero, the baby is floating inside or swimming inside amniotic fluid, and there is all over everywhere there is water. There is no oxygen for the baby to take. So what is the function of lungs? Do you know that? Anybody can tell me what's the function of lungs in a baby or in all of us?
Need to exchange the
Yeah, it is to
oxygen and
exchange
carbon dioxide.
gases, right? To change gases, like to take oxygen and to remove carbon dioxide,
Carbon
right? This is the
dioxide.
function of lungs. And lungs love oxygen, right? Don't they? Yeah, they do. Lungs love oxygen. They want oxygen and they remove carbon dioxide. When we love something, we want it. And when we don't love it, we remove it, right? So because lungs take oxygen, that's why we know that lungs love oxygen. For a baby who is swimming inside amniotic fluid, the lungs cannot have oxygen. Do you think if you love something and you don't have it, will you be happy or will you be sad about that? If you like something and you cannot have it, of course, lungs,
Sad.
yeah, lungs will be upset or sad. So the lungs of the baby are sad or upset. Whenever we are upset or whenever we are sad, uh, uh, our blood pressure goes high or goes down. When we are sad, we are tense. The blood pressure is also tense. The arteries will constrict, right? So we know that lungs love oxygen. In baby, in adult, and anywhere, whenever lungs cannot have oxygen, they are sad. This is. It doesn't mean that they are really sad, but this is my imagination. I always think like this: that lungs are sad, lungs are tense. Whenever lung is sad, it constricts its arteries. When we are sad, our blood pressure goes high. When our lungs are sad, the blood pressure and lungs goes high. So it is called pulmonary hypertension, right? This is, I hope this is helpful for you all to remember. Whenever lungs don't have oxygen, they are sad. And when lungs are sad, their blood pressure goes high. What is the blood pressure of the lungs? It is pulmonary hypertension. So the pulmonary gets sad and the blood pressure goes high, and this is called pulmonary hypertension. If it is in the baby or if it is in COPD or if it is in asthma or wherever, those who doesn't have oxygen, enough oxygen, their pulmonary circulation will be constricted and they will have pulmonary hypertension. The same thing happens in the baby. In the babies, there is physiologic pulmonary hypertension. This is not pathologic because the babies are inside the amniotic fluid and they don't have oxygen, so the lungs are sad and the blood vessels in the lung, which is called pulmonary circulation, those are all constricted. Once the blood circulation is constricted, the pressure in the right side of our system or in the lungs goes high, the blood pressure goes high. So we know that right atrium is connected to the right ventricle and right ventricle is connected to the lungs. So whenever the pressure of the lung is up, the blood pressure in the lung is up, the pressure in the right atrium will also be up. Do you agree with that now or not? So we know that the right side pressure goes up in utero. Why? The reason is because the lungs don't have oxygen and they get mad, they get sad, they get upset, and the blood pressure goes up. Whenever lungs blood pressure goes up, right side of the heart pressure will also go up because right ventricle and right atrium is connected to the to the to the lungs, right? So now we know that the right side pressure will be up and the left side pressure will be down. Left side pressure is not down, but comparing to the right side, it will appear down. So the pressure in the right side is up and the pressure in the left side is down. So this up pressure can push this symptom away. So you see this symptom away, right? So whenever the pressure is up in the right side, the symptom will be pushed away. And this door will be open for the blood to go to the other side of the heart, right? Whenever the baby comes out of the uterus or the baby is delivered, right? The baby starts crying and starts breathing. And the lungs take oxygen, right? Lungs of the baby is taking oxygen. Once the lungs are receiving oxygen, lungs become happy, right? Everyone becomes happy when the baby is delivered, right? Everyone feels happy. The same time, lungs of the baby is also getting happy. Once the lungs of the baby is happy, the pressure in the lung gets down because in happiness, we don't have hypertension, right? The blood pressure doesn't go up whenever we are happy. So the pressure in the lungs come down and the pressure in the atrium also goes down. And this pressure which goes down cannot push this symptom away and these two symptoms get together and the left pressure goes up. Why? Because this pressure comparing to this pressure, because this pressure is removed now, and the pressure on the left comparing to the right goes up, and this left pressure push this symptom toward the other symptom, and those two symptoms stick together, and the duct or the connection stops, and the heart closes, right? The foramen closes. Did you understand that? I hope I explained that well enough so that you understand. This is the way I used to remember uh, pulmonary system and cardiovascular system, just like a story. I made this story just inside the uterus. The heart should be open. Why these foramens are open inside the utero, and why those are closed out of the uterus, and how oxygen helps with the lungs vessels to be dilated, and how lack of oxygen will cause vasoconstriction inside the lungs. And this was an easy and simple way for me to remember. And the same thing about the symptoms. You used to see a lot of questions about symptom premium, ostium secundum. Those are explained so difficult and everywhere. And the way I used to remember is this one. I always consider Cushing as landmark for all of them. The symptom premium comes down to endocardial quotient and makes the symptom premium. So here was the ostium premium. Ostium premium was the primary ostium. Here it is already ostium premium. So symptom premium comes down to the endocardial quotient and makes symptom premium, or the first membrane. And whenever this first membrane is made fully, the connection between two right and left atrium is stopped, and the right atrium wants to send blood to the left atrium, because the right atrium has a high blood pressure and sends all the blood to the left atrium, so that the left atrium sends it to the system. So there will be some regression in the symptom, some regression. It means that some part of the symptom will be regressed, or will involute, or will degenerate. And this will make another connection between right atrium and left atrium. This is called ostium secundum, means the secondary hole of the heart, which is made on the primary symptom. And then once this ostium is made, the heart thinks with itself, what am I gonna do with this hole? This hole is helping me inside the utero, but once I'm out of the uterus, what am I gonna do with this connection? This connection should not be forever. I need it only for temporary purpose. I need it only for whenever I'm inside the utero. But once I'm out of the uterus, I don't need any hole in my heart. So that's why another symptom comes down and says that don't worry. I send another symptom. This symptom is going to help you. Whenever you are inside the uterus, this symptom is going to close and open, and you will have a connection between right and left. But once you are born, you are delivered, then the left atrium will have increased pressure, and these two symptoms will get together and make and stop and connecting with each other, and the hole will be closed. Did you understand it well or not? Just I'm
No,
waiting.
can you repeat it, Mahjuba, again, please?
Yeah, sure, of course. So we won't be to repeat it. Just if you can unmute yourself, let's do it together, right? So at first, this is the heart, right? This is the heart. All four chambers are not are made, but they are connected with each other. What is this, Dr. Uruj? What is this?
Septum primum?
This is endocardial quotient, right?
Sorry, endocardial question.
Yeah, endocardial quotient is the first thing that comes to the heart, right? Endocardial quotient. How does it come here? It is coming from neural crest cell, right? Neural crest cell. We already know that they are made of ectoderm, right? Neural crest cell. So this comes here. What is the purpose of endocardial quotient here? This is a landmark for all the symptoms. Symptoms from down to endocardial quotient, symptoms from up to endocardial quotient, symptoms from both sides. This is a landmark. So it means that all the symptoms that are made to the heart, they just find their address toward endocardial quotient, right? This symptom comes down to endocardial quotient. These symptoms come up to the endocardial quotient and from those sides. That's why the heart has four chambers, right? Do you understand till now?
Yes.
Okay, now let's remove this symptom. Is it a hole or not? Is it connected or disconnected? Left.
It's
This is
not connected.
imagine it is not connected. So those are disconnected. That means that the heart has a hole. This is a hole, right? This is called ostium. Ostium means a hole, right? There is a hole or this connection between two ores. This hole is primary. It means that it is there from the beginning. A heart has a hole from the beginning as a ostium. This is called ostium premium, right? Okay. This is a hole in the
Yes.
heart. So now this hole shouldn't be there because we are not supposed to have a heart with the hole, with the ostium, right? So there should be a symptom. The symptom comes down from the upper part of the atrium to endocardial cushion. It reaches endocardial cushion and makes the symptom. This is called septum. Which type of symptom? Premium. Why premium? Because it is the first symptom which is made. Of course, the name says what it is. Symptom premium, right? Okay. Now that this symptom premium is made, you see that right side and left side has no connection. This is a very good thing for after birth, but inside the utero, there should be a connection with the right side of the heart and left side of the heart. Why? Because right side of the heart bring blood from the mother of the baby, from umbilical vein, and right side of the heart is supposed to send those blood to the left side so that the left side sends it to the system. Do you understand till now, Dr. Uruj?
Yes,
Does it make sense now?
it does.
We are not supposed to disconnect, right? We are not supposed to disconnect heart
Just
in general. Yeah,
yes.
it is a good heart for after the birth, but for inside
After
the
the
utero, we
delivery,
need
yeah,
it. Yeah,
before, yeah, needs
before,
to be
yeah,
connected.
before this connection. So, in order now, heart says that don't worry, the symptom is made now. We cannot remove all the symptom, but we can remove a part of the symptom. This is we remove a part of the symptom. Now you see there is a connection, right? And a hole is made here. The symptom, a part of the symptom regresses. Regress means that a part of the symptoms necrosis and, itself, like it says that ostium premium regresses, a part of that. This is called cell death. A part of the ostium premium dies, right? Or necrosis. So this is called regression of the symptom premium, not all over, just a part of it. So another hole is made. This hole is called ostium. Which type of ostium?
Secondum,
Secondum,
right?
of course, because it is made secondary, not primary, right? Primary ostium was from the beginning. This is secondary ostium. Now that this connection is made, again, the heart says that this is good for before delivery. But once I'm born and after delivery, I know I don't need this hole, right? This hole should not be after delivery. And how to close this? This is already open. We cannot close it. So this part of the atrium says that don't worry, I have another symptom to send. Another symptom comes down in order to close this hole, right? This is called symptom.
Septum
Which type of
secondum, right?
exactly, yeah. Symptom secondum. So this is septum secondum, means that this is the secondary membrane which is made to the right side of the heart. So this symptom secondum uh, solves all the problems of the heart. How does it solve it? It says that whenever you are inside the utero before delivery, I am going to push this door, this port away and open it so that you can send blood to the left side of the heart. But whenever after delivery, the left side of the heart has a high pressure, this part cannot push it because the left side of the heart has elevated pressure and right side of the heart has decreased pressure. Why decreased pressure? Because when there is oxygen, the lung is happy and the pressure goes down, right? So the pressure of the lung is down, the right atrium pressure goes down, and this symptom will stick together and will be closed. Did you get it now? We have ostium premium,
No.
we have symptom premium, we
Okay.
have ostium secondum and septum secondum. So
So,
where didn't you
uh,
understand?
so after delivery, the right atrium pressure is down and left atrium pressure is up. But
Yes.
before delivery, it's the same.
No.
No?
Before delivery, see, before what happens before delivery? So before delivery, the baby is swimming inside the amniotic fluid, right?
Yeah.
Is there
But
any
I've,
oxygen inside the amniotic fluid?
Oh, yes. No?
Is there? No, there is no oxygen, right? So
Okay.
the lungs don't have oxygen, the lungs of the baby, right?
Okay.
If the lungs of the baby don't have oxygen, what happens to the lungs arteries? What happens to
Um,
the lungs blood pressure? The blood
where's the
pressure of the lungs goes
constriction?
up.
Goes down, up. Okay.
Yeah. Yeah. So it goes up. So it is called pulmonary hypertension, right?
Hypertension.
Why
So in babies,
hypertension?
like not in babies, actually, in utero, all the like embryo has pulmonary hypertension.
Yeah, exactly.
Okay.
And utero, the embryo has, it is kind of like pulmonary hypertension. It is physiology.
Okay.
It should
Okay.
happen
Okay.
because it is made to happen, right? The baby is inside the
Okay.
water and cannot have oxygen, so the lung is unhappy. When the lung is unhappy, it constricts the vessels. When we
Okay.
are
Makes
unhappy,
sense.
yeah, when we
It's
are unhappy,
hypertensive.
our blood pressure goes up, right? Because we are unhappy. And when lung is unhappy, the pressure inside the lung goes up. And we know that the pressure inside the lung is connected with the pressure in the right side of the atrium, right side of the heart, right? Because
Mm-hmm.
right side of the heart has pulmonary artery and left side of the heart has aorta. So whenever pulmonary arteries are constricted, this pulmonary artery will be constricted. It will be constricted, and the right atrium will have an elevated pressure. Why? Because whenever pulmonary artery, which is in the right side, right, pulmonary artery, this artery has a lot of pressure. Right atrium will also have a lot of pressure in order to push the blood, right? So the pressure in the right side of the body is up inside the utero. That's why this right side of the body can push the membrane to the other side. Left side and right side, they don't have the same pressure in the utero and out of the utero. In utero, the right side pressure is up. Why? Because of pulmonary hypertension. And I already said the reason. And after the baby is born, the baby gets oxygen, the lungs are happy, the lungs don't have elevated pressure. Right atrium also has decreased pressure, and left atrium pressure increases, right? Does it make sense now?
Why left atrium pressure increases?
The left atrium pressure doesn't increase. This
It
is left,
doesn't.
this is right. It doesn't
Yeah.
increase. Comparing to the right side, it is elevated,
Okay.
right?
Just because
Yeah. You
one.
see, this is the right atrium, right?
Yeah,
In right
it makes
atrium,
sense that the right atrium pressure was increased before, but after the baby is born, it got decreased. But why the
so
left side is increased?
so comparing to the right side, it is increased, right? And
Oh, okay. Now it makes
yeah,
sense. If we
yeah,
compare it.
yeah. If we compare it, and the
See.
left side is increased, even in inside the utero, the left side has a pressure, but the right side is more because the vessels are constricted. And the other reason that the circulation is starting and the most of the blood comes to the left side of the body, not to the right side. Inside the utero, all the blood came from the umbilical vein to the right side of the heart. That's why a lot of blood used to come here, and lack of oxygen was causing elevated pressure. But once the baby is born, from one side, the right pressure comes down. Why? Because of oxygen, the right pressure comes down, and the left pressure comparing to the right side increases. Why? Because a lot of blood is coming to the left side directly. The baby umbilical vein is disconnected, and all the blood comes to the left side. So wherever the blood goes, the pressure also goes up, right? Does it make sense now?
Yes.
Okay. So let me see if I have any other question here. What about others? Do others also understand what I mean or not? Is it helpful for everyone else? Should I continue? Yeah, I hope so. Thank you so much. So let's continue. Now we will read the lines of the first aid. So, uh, whenever I was preparing for my step one, these lines never made sense to me. I used to be confused all the time because those are and not explained as like a textbook. It is explained just so like outline. It is not easy to understand before understanding the concept. Now we see symptom premium grows toward endocardial caution, narrowing ostium premium. See, it means that first there was ostium premium. Here, this one was first. Ostium premium was made first. There was a hole inside the heart first. Then symptom premium or the secondary symptom grows downward to the endocardial portion and makes symptom premium, right? And if if this symptom is not made, if the symptom is not made, what do we call it? What do we call this? Atrial septal defect, ASD, right? So how many types of ASD we are supposed to have based on the explanation? How many symptoms that we have? We had symptom premium. So ASD, premium ASD. It means that if the premium symptom is not made, the atrium will have a septal defect. The symptom will not be made. How many symptoms do we have? We have primary symptom and we have secondary symptom. If the primary symptom is not made, this is called ASD premium. And this is very common in which syndrome? In Down syndrome. In Down syndrome, we have ASD. Everything starts with A in Down syndrome. ASD, Alzheimer, and many other findings. So ASD and Down syndrome is due to defect in symptom premium. It means that in Down syndrome, they are so down, they cannot even make this primary symptom. So this is ASD common in Down syndrome. So what about ASD secundum? It means that the second membrane is not made. This is called ostium secundum, ASD secundum type. It means that the secondary symptom is not made. And this is most common type of ASD. And believe me that you are going to see a question about that. That they usually say that which type of ASD is common. So remember that secondum or ASD is most common type. And the premium is in Down syndrome. So you can even note it down just because I saw it in questions. That's why I put it here. So let's see the lines of the first aid. Now let's see if it makes sense to us or not. Symptom premium grows toward the endocardial cushion. We already know that because endocardial cushion is the landmark of all the symptoms to go towards. Narrowing ostium premium, it means that they disconnect right side and left side and they close the ostium premium. Ostium premium was the primary ostium, right? Ostium secundum forms in the symptom premium. Now that we have symptom premium, right? And the left side of the heart and right side of the heart is disconnected, right? So the heart wants a hole inside when they are inside the uterus. So ostium secundum needs to be made. So ostium secundum is made on the symptom premium. On the primary membrane, there are new holes will appear, and those new holes are due to cell date. How does cell date happen? The ostium premium, a part of ostium premium regresses. Small perforations are made in the ostium premium to make a big hole between right side of the heart and left side of the heart, and this ostium or this hole is called ostium secundum. We already know that, right? And now let's see to the number 3. Symptom secundum develops on the right side of the symptom premium. Because now that we have a symptom premium and on the symptom premium we have some holes and some perforations, this is called ostium secundum. Heart says that, of course, I do need a connection, but this hole will stay forever. What am I going to do after birth? So the symptom secundum comes to the right side and say that I'm going to cover this. Before birth, this door will open, and after birth, these two doors will stick together and will close. So the symptom secundum solves all the problem of connection and disconnections. We already explained it twice. So symptom secundum develops on the right side of the symptom premium as ostium secundum maintains right to left shunt. We already know that. Why right to left shunt? Because right side of the body has elevated pressure. Why this elevated pressure? Because right side of the body is connected to the lung and lung is unhappy and lung's blood pressure goes up and the pressure in the right side also goes up and push the door away and opens it toward the left. And all the blood that comes to the right side of the baby goes to the left side. And this is very helpful. This high blood pressure, this sadness of the lung, this unhappiness is the best unhappiness because it is helping the baby to have a lot of blood. Why there is a lot of blood in the right side of the baby? Because the right side of the baby has connection upwards with the lungs and downwards with the umbilical vein, because all the veins of our body goes to the right and all the arteries are generating from the left side, and this is common everywhere and all adult and babies. So the right side of the heart has umbilical vein, and this umbilical vein brings oxygenated blood from the mother to the right atrium, and right atrium pushes the door away. Which door? The septum premium away, because it has a lot of pressure and it can push the door, right? And all the blood goes from right to left. This is called right to left shunt. Whenever symptom secundum is not met, whenever symptom premium is not met, this is called ASD. And we have two types of ASD, ASD type premium, ASD type secundum, and this one is the most common one. And this one is associated with Down syndrome. Most of the NBME questions or just asking questions about these types. Whenever you don't need to know all the developments, but in order to remember these types of ESD, we need to know the concept, because whenever we know the concept, life gets easy for us. It becomes easy for us to maintain it, because whenever we are studying, everything makes sense. Everything is easy to understand. But when we finish first aid, we cannot maintain it. We cannot remember everything, because it takes a lot of time to finish first aid and to finish UWOT. And when we come back for the second review, we see that we almost forgot everything. Why? Because we didn't make it easy for us. We didn't make a story out of it. We didn't find ways to maintain it. This way made my life easy. I hope this is also helpful for you guys. So now we understood until this part. Septum secundum expands and covers most of ostium secundum. So what is ostium secundum? You know that ostium secundum, this was primary symptom. Ostium secundum was here, a hole on the septum premium. So septum secundum expands and covers most of ostium secundum. It means that this is a symptom that covers most of ostium premium, ostium secundum, sorry. The residual foramen is foramen oval. So, and we said that the right side of the heart has an elevated pressure and pushes this door away, and this door becomes like this. And all the blood goes to the left side of the body through this door, right? Because right side has elevated pressure and left side has decreased pressure. So this pressure pushes the door away and sends the blood to the left side of the heart. Whenever the baby is born, the left side pressure increases, right? And the right side pressure decreases. And we know why, because the oxygenated blood makes the lung happy and decreases its pressure. So the left side of the heart has increased pressure. Now the left side of the heart pushes the door back and closes it, right? And this is called foramen ovalis, right? The residual part. So let's see what else. Remaining portion of septum premium, remaining portion of septum premium forms the one-way valve of the foramen oval. We already said that this is septum premium, right? And there is a hole and there is a disconnection here. Let me make it this way so that this is septum premium, right? Inside the septum premium, there was a hole. This was called ostium secundum. This is a hole. Let's close it. This was septum premium and the hole inside. And the septum secundum comes to the right of it until here, right? This is septum secundum. This septum secundum covers the most of the hole, right? See, the hole is from here up to here. It covers up to here. This is right side of the heart and this is left side of the heart. Whenever the pressure is high in the right side of the heart, right side of the heart pushes, with the pressure pushes this door, not this door. So it pushes the door and the door opens like this. See? The door is open. Now, does it make sense properly? See? And all the blood goes to the left, right? Did you understand it now properly? And whenever the left pressure goes up and the right pressure goes down, the left side pushes back this membrane and brings it here. And these membranes stick together because left side pressure closes the door. It shuts this door. It doesn't let it to open after birth. Why? Because left side pressure increases and right side pressure decreases. Uh, and a remaining portion of the symptom premium forms the one-way valve foramen oval. This is one-way valve. One-way valve means that the right side can open it and the left side can close it. This is one-way valve that opens and closes, and after that it closes. Did everyone understand it or not? Was it easy to get, or should I make it more easy? So a symptom premium closes against symptom secundum. This was symptom premium with a hole inside, and this was symptoms secundum. Both of them stick together after birth and they seal and they close. This is called symptom premium. Symptom premium closes against symptom secundum, sealing the foramen oval soon after birth because of increased left atrium pressure and decreased right atrium pressure. We already know the reason why decrease our right atrium pressure, because the lung is happy after birth. The lung has a lot of oxygen, no need to have hypertension, right? So symptom secundum and symptom premium fuse during infancy, early in childhood. So I said that these two symptoms stick together and day by day they fuse and they close. And the symptom secundum and symptom premium fuse during infancy and early childhood, forming the atrial symptom. And these two symptoms get together and make the atrial symptom. Whenever this symptom is not met, this is called ESD, and whenever this symptom is not made, this is called ASD again. ASD premium type, ASD secondum type. Secondum type is the most common type, and premium type is not most common, but it is usually seen in Down syndrome. And we already know everything about foramen ovale and everything. So patent foramen ovale. Patent means open. If this foramen is open, we said that this symptom premium and symptom secundum, they are two symptoms beside each other, and they are working as a one-way valve. And this valve is called foramen ovale valve, right? It is supposed to be open before birth because right pressure is increased and right pressure pushes the door away and opens it. But after birth, it should be closed, right? Whenever it stays open, this is called patent foramen ovale. Failure of symptom premium and symptom secundum to fuse after birth. We said that those two symptoms should stay